Hi, I'm Dr. Margarita Camacho, and I invite you to join us in Chicago, September 20th and 21st, as the Society of Thoracic Surgeons hosts its symposium, Mechanical Circulatory Support for Advanced Cardiopulmonary Disease. Last year's symposium nearly sold out, so make plans to register today. Attendees found last year's event so timely and valuable that they've asked us to host the event more frequently. Technological advances with smaller, more durable, and percutaneous approaches have expanded the availability of mechanical circulatory technology for both temporary and long-term support. The day-and-a-half symposium will provide a comprehensive overview of the important elements necessary to initiate and maintain a heart and lung support program that utilizes advanced technologies and offers attendees a hands-on experience in device operation and implant techniques. The immediate availability of mechanical circulatory support can greatly affect a patient's chance for survival. Here are 3 sample cases. A 55-year-old male admitted with acute aortic dissection and involvement of the right coronary ostium underwent repair of the dissection. Right ventricular failure was noted on the intra-op TEE, and a vein graft to the right coronary artery was performed. Despite this, he could not be weaned from bypass, and a right-sided assist device, or RVAD, was placed in 20 minutes. He fully recovered, the RVAD was explanted 5 days later, and he was discharged home. A 65-year-old male underwent an elective CABG x3 and MVR, but could not be weaned from bypass. The center did not have an LVAD, only an intra-aortic balloon pump. Another center was called after the surgeon attempted to wean from bypass several times and 6 hours of bypass had elapsed. By the time the visiting team arrived, almost 8 hours of bypass had elapsed. At this point, the patient was in florid pulmonary edema, and ECMO was placed in less than 30 minutes. Although the ECMO functioned well, he was very coagulopathic, edematous, anuric on CVVH, and expired 2 days later. Were an LVAD or ECMO immediately available, intervention could have occurred much earlier as a potential bridge to recovery or other intervention. A 23-year-old female with a history of flu-like symptoms was admitted with rapidly worsening respiratory failure. She was soon intubated and could not maintain an adequate PO2 despite maximum FiO2 on the ventilator. Veno-venous ECMO was established quickly via a dual lumen catheter placed percutaneously in the right jugular vein. After several days of full support, she was gradually weaned from ECMO after 8 days, eventually extubated, and discharged home several days later. These 3 examples illustrate the complexities of patient management and the importance of preparedness. The STS Symposium will feature experienced surgeons and cardiologists for what promises to be a comprehensive, dynamic, hands-on overview of this new era of circulatory support. For more information and to register, please visit www.sts.org/MCS. Thank you, and we hope to see you in September.